Hi there, guys. My name is Alice Schmidt, and I'll be presenting on the pathophysiology and pharmacology related to Graves' disease. So, the pathophysiology of Graves' disease, first of all, the thyroid gland, this relates to the thyroid gland, and this can be located just below the larynx. Its primary responsibility is ensuring the formation and secretion of the thyroid hormone. For thyroid hormone to be created, the thyroid needs iodine, which can be found in table salt and water. If there's inadequate or excessive amounts of this present within the body, this can affect the amount of thyroid hormone that is made and secreted. In relation to baseline function before disease is present, there are roles that the thyroid hormone is involved in. So the thyroid produces approximately 90% inactive thyroid hormone, also known as thyroxine or T4, and 10% active thyroid hormone, which is triiodothyronine, which is a bit of a mouthful, but we'll refer to it as T3 going forward. So the T4 hormone can then go on to be converted to either activated thyroid hormone or to be an alternative inactive thyroid hormone. Thyroid hormone typically induces effects on many organ systems in the body and can generally increase their function and metabolism. So when present in the heart, the thyroid hormone allows for an increase in cardiac output, stroke volume, and resting heart rate. Active thyroid hormone, also known as T3, can work to increase contraction force and speed. And then this overall can lead to decreased peripheral vascular resistance as well. T3 is also related to resting respiratory heart rate and helps to normalize arterial oxygen concentration to compensate for increased rates of oxidation. This is also able to promote oxygen delivery to tissues around the body as well. T3 stimulates the nervous system and helps with increasing wakefulness, alertness, and responsiveness to external stimuli. And thyroid hormone is actually able to also increase peripheral reflexes as well. This relates to actions of organs around the body and stimulating their activity. Thyroid hormone also plays a role in reproductive health and other endocrine organ function. This allows for regulation of normal reproductive function in both men and women by regulating the ovulation cycle and the formation of sperm as well. And as this is related to reproductive health, this can concern females' chances of becoming pregnant, which is always something to be considered. Graves' disease can be triggered by a combination of genes or external triggers such as a virus. There was some research done around that. With Graves' disease, the immune system produces an antibody called thyroid stimulating immunoglobulin, TSI. This attaches to the thyroid cells, and TSI then acts as if it is thyroid stimulating hormone, which is TSH, which tells the thyroid how much thyroid hormone to produce. And this then means TSI causes the thyroid to make too much thyroid hormone. So then when we look at the normal ranges of these hormones and what they're supposed to be within the body, T4 usually sits at about 77 to 155 nanomoles per litre, and T3 usually sits at 1.2 to 2.8 nanomoles. If the individual has Graves' disease or hypothyroidism, it can be reported that there's an increase in both these numbers for T3 and T4 and supports the diagnosis for Graves' disease. So let's have a look at a thyroid gland. So we've got that one there, and you can see the border of where a normal thyroid gland is and what the enlarged one looks like. So a normal appearing thyroid gland can be described as soft, smooth, symmetrical, and not feeling tender, and it's able to slide upward just slightly when swallowing. But this can change when disease is present, as it can lead to an enlarged thyroid, and the patient may develop masses on the gland, and that can be discovered as part of assessment for the diagnosis. It would also help to palpate the area to be able to feel the size of any masses or the gland itself. Okay, so then medication that we have available. So the pharmacology. One of the most common drugs used to treat Graves' disease is methimazole, or MMI. This type of drug is an antithyroid drug, which is considered to be a thioamide, which works to normalize thyroid hormone levels within the body. This particular drug works for the inhibition of thyroid hormone synthesis, and also holds the potential to alter thyroid autoimmunity. This drug inhibits the action of an enzyme called thyroperoxidase, which is involved with the synthesis of thyroid hormones, which then block the thyroid gland, and this can either directly or indirectly affect the immune system. And methimazole can ensure that the patient's thyroid hormone is regulated and controlled. And there are my references for that one as well. Thank you for listening today.